Hello everyone. So today we are going to do the mechanism of intracellular accumulation. So there are basically four mechanisms of intracellular accumulation. Either there's gonna be abnormal metabolism, and because of this, there's gonna be increased level of certain substances. For example, there's gonna be in fatty liver, there is increased level of the fats in the liver. Either there's gonna be mutated substance the mutation of the protein, and because of this there's gonna be accumulation, and third there's going to be increased level of the endogenous substances. The endogenous substances, like there's certain substances in our body that has to be converted into the simpler form and has to be excreted from the body, but if their level is increased in the body, so there's gonna be accumulation. And the fourth point is either there's going to be increased level of the exogenous substances. There's certain substances which we take from outside and they has to be excreted after our required function is done, but if their level is increased in the body, so there is going to be accumulation. So we did four things. First we did the abnormal metabolism, second we did the mutation, like the protein mutation, third we did the exogenous substances accumulation, and fourth we did the endogenous substances accumulation. Now we are going to do the pigments. Pigments are the substances, they can be pigments are the substances that can be exogenous, and they can be endogenous as well. If we talk about the exogenous one, there are lead, silica, asbestos, coal. Okay. Now if we talk about the endogenous one, so there is lipofusin, melanin, and hemosiderin. If we talk about the lipofusin, so it is a wear and tear pigment. It is yellow brownish in color. Wear and tear pigment, yellow brownish in color. It is going to cause brown atrophy, and it is going to cause injury by lipid peroxidation. So it is going to be composed of lipid slash phospholipid plus protein by lipid peroxidation, and it is mainly common in old patients or calcification. Okay, now we are going to do the melanin. So melanin is the normal pigment which is present in our skin, and it is responsible for pigmentation of our skin. So it is composed of amino acid tyrosine in the presence of enzyme tyrosine kinase. So increased level of the melanin is going to cause ochronosis, like really black people, and the reduced level of the melanin is going to cause albinism. It is a genetic disorder. Now the third pigment is the hemosiderin. Hemosiderin is the pigment which causes the bruises. So it is an iron containing pigment, and it is going to be stored in the form of apoferritin, going to be transferred from one place to another in the form of transferrin, and they're mainly present in the form of ferritin. So the ferritin is going to be converted into hemosiderin, and hemosiderin is going to cause hemochromatosis. Now we're gonna do the pathological calcification. So in pathological calcification, there's gonna be increased level of the calcium level, along with certain other salts like iron or magnesium or phosphorus, um, in any tissue of the body other than teeth and bone is known as the pathological calcification. And the pathological calcification are of two types, dystrophic and metastatic. Dystrophic calcification is calcification, like remember D with the dead. So it's type of calcification which happens in dead or dying tissues, and this type of calcification happen when the calcium level is normal inside the body. And if we talk about the metastatic calcification, so in metastatic calcification the calcium level is increased inside the body, so the calcium concentration in and it happens in the normal tissues, like the normal cells, either because of certain reasons, like either there is going to be increased level of the vitamin D, increased level of the parathyroid hormone, there's going to be renal problem, or there's going to be protein destruction, bone destructions. Thank you. We did it. That's it. Thank you.